do is just welcome everybody, Benjamin Franklin High School. Today we're talking about back to school and vaccines. We've got our best number of speakers with us today, folks from the Black Doctors Consortium, Children's Hospital of Philadelphia, School District of Pennsylvania, and myself from the Philadelphia Department of Public Health. As mentioned earlier, we'll get to the Q&A later, but first I would like to introduce Dr. Kendra McDowell, who is Medical Officer at School District of Philadelphia.
Good morning. As mentioned, I'm Dr. Kendra McDowell, the Medical Officer for the School District of Philadelphia and a pediatrician. It is timely that we are here at Benjamin Franklin High School, where the district, along with Black Doctors Consortium and Greater Philadelphia Health Action, are holding 2-week-long back-to-school vaccination clinics. First, I want to thank Dr. Edwards, the Benjamin Franklin's principal, for hosting the clinic and opening her school doors to students to receive their school-required immunizations. In Philadelphia and across the Commonwealth, students are required to have vaccinations to attend school. We know that vaccines are safe and effective, and they are key to keeping children in our community healthy. As a district, we believe that a student's health and their education are connected. Children have to be healthy to learn. Vaccines protect students against preventable diseases such as the measles, whooping cough, and chickenpox. In 2026, these diseases are very real threats to the health of children and communities. Unfortunately, there has been a resurgence of vaccine-preventable diseases due to declining vaccination rates. We are seeing in real time the tragic consequences of children and adolescents not getting vaccinated, with the recent death of 2 unvaccinated individuals from measles. At the district, we are focused on protecting our students and staff from these diseases, and we are working closely with the Philadelphia Department of Public Health to prevent this from happening in our city. The district is committed to reducing barriers to families accessing school-required vaccinations. This is why the district has organized multiple vaccination events throughout the summer and school year. These events are held in community and in our schools, where families live, work, play, and learn. We would like to thank our committed and trusted health partners who are in the community and working in schools to provide health care and vaccinations to district students. Black Doctors Consortium, Greater Philadelphia Health Action, Covenant House, Delaware Valley Community Health, Family Practice and Counseling Services Network, University of Pennsylvania, Department of Family Medicine, and the Philadelphia Department of Public Health. We are grateful for the partnership in getting students vaccinated and attending school. Lastly, I want to thank district families who have vaccinated their children and chosen to protect them against vaccine-preventable diseases. Thank you for entrusting your children in our care. To families that may be hesitant about vaccines and still have questions, talk to your pediatrician, your school nurse, and seek out information from trusted sources like CHOP's Vaccine Education Center. We are here to listen, answer your questions, and provide you with credible and trustworthy information about vaccines. I strongly recommend that all students get their required vaccinations to attend school. We are all in this together to keep our students healthy and safe.
Good morning. I'm Dr. Ayla Stanford, pediatric surgeon and founder of the Black Doctors Consortium. You heard what's at stake. I want to talk to you about what we're doing about it. Measles is now in 28 Pennsylvania counties, more than 400 cases this year, and nearly half of them in the last month alone. 73 Pennsylvanians hospitalized, 22 of them children. Last week, Pennsylvania was #1 in the nation in newly reported cases, and nationally, we have had more measles in the first 8 months of this year than all of last year, and the most since 1991. This is not a mystery, it's arithmetic. It takes 95% of us vaccinated to stop measles from moving through a community. Pennsylvania is at about 93, and not one county in this region is at 95. Here is what I want parents to hear. As a physician, as a mother of 3 children who are fully vaccinated, as am I from infancy on, the PA department reported this week that of every confirmed measles case in Pennsylvania this year, not one has been in a person who completed both doses, not one. A child does not receive their first measles shot until 12 months old. So every infant in this city, in the stroller, in the car seat, at the family reunion, has no protection of their own. We are their protection. That is the entire system. And measles does not wait for the rash. You can be contagious 4 days before those spots ever appear. The virus hangs in the air for 2 hours after you have left the room. By the time you know you have it, everyone around you has already been exposed. And not just the children. It's the teacher, the lunchroom lady, the man who sweeps the floor, the security officer at the door. You do not know who they go home to at night. You do not know who is on chemotherapy, who has had a transplant, who is caring for a newborn. That is why we're here today. Today, a family can walk into this building and a student can get a physical, get vaccinations, mental health screening, and get their vision checked. Measles is one of the most contagious viruses we know, but it is not the only one we can prevent. So we're here with MMR, polio, varicella, Tdap, meningitis, and others. And we do not just tell your child they need glasses. We make the appointment. We do not just see if your child is struggling. We connect you with someone on site. That's what access looks like. Proximity with purpose. We need more of it where people live, work, and play. And we did not coordinate that. Like our center at 2001 West Lehigh Avenue, where in 2027 in North Philadelphia, we will have CT, X-ray, ultrasound, and mammography. I'm grateful to the School District of Philadelphia for opening these doors. Let's get these students vaccinated and protected. Thank you.
Good morning, everyone. My name is Erica Hayes. I am a pediatric infectious diseases physician at the Children's Hospital of Philadelphia. I'm also the senior medical director of infection prevention and control there. We find ourselves in a unique position in 2026. Because of the success of vaccines, many people, generations even, have forgotten the seriousness of vaccine-preventable diseases. Here in Pennsylvania, we've seen a stark and sad reminder of how serious these infections can be. Whooping cough or pertussis infections for young infants under 2 months of age, even today, can have a fatality rate of 1 in 100 in infants whose mothers are not vaccinated in pregnancy. Vaccine-preventable diseases are real threats to the health of all children and adults, and even more so for young infants, pregnant individuals, and immunocompromised people of all ages. It's important to remember in the pre-vaccine era, there were over 5 million cases of vaccine-preventable infections annually, with 17,000 deaths every year. We have decades of vaccine data from around the globe, and the data is clear. It's crystal clear. Vaccines are safe and effective, particularly when we compare the side effects of vaccines to the very serious consequences of the infections themselves. There is no question. Parents can be confident in the safety of vaccines given this data and ongoing surveillance that is always done with the introduction of new vaccines and ongoing monitoring for established vaccines. Unfortunately, there is a lot of vaccine misinformation out there. Parents should not let that sway them from giving their children one of the most tested and effective positive health interventions in history. We also know it is safe to give multiple vaccines at a time and combination vaccines to infants. An infant's immune system is presented with several-fold more antigens daily than is in the entire vaccine schedule. And the American Academy of Pediatrics vaccine schedule is designed to ensure children get protection from serious infections like whooping cough, bacterial meningitis, and others at the times when they are most vulnerable. Spacing out vaccines is unnecessary and prolongs the time that children are at risk. Making sure children are up to date with all of their vaccinations is one of the most important ways to keep them healthy and thriving. Thank you.
Thank you very much, Dr. Hayes and other doctors. While we're here today to talk about the vaccines needed for schools, I wanted to talk about something a little bigger. Vaccines are great at lowering your risk for contracting disease, but their real benefit is to the community. Simply put, the more Philadelphians get vaccinated, the safer we all are. The more Philadelphians get vaccinated, the safer our most vulnerable are. When fewer people are vaccinated, the more we see disease spread. So let me make this clear. You getting vaccinated and vaccinating your children is an investment in our communities. Your vaccination can help save lives. Your vaccination can help protect unprotected babies. Your vaccination can help protect the elderly Philadelphians. And if you don't believe me, talk to your doctor. As we've already heard today, the doctor you already trust to take care of you and your family believes vaccines are worth the pinch. Getting vaccinated is as easy as it's ever been. The best place to start is www.phila.gov/vaccines. People with insurance can usually get vaccines at their doctor or pediatrician and often in pharmacies. Philadelphians who don't have insurance are eligible to be vaccinated at any of our city health centers and a number of other community clinics. Children can often get vaccinated at our health centers and these clinics at no cost through the Vaccines for Children program. You can find your nearest health center by visiting www.phila.gov/healthcenters. Today, I'm proud to stand with our colleagues at CHOP, the school district, and the Black Doctors Consortium to remind Philadelphia, vaccines are the best way to protect yourself, your family, and your community. Thank you. At this point, we'll open it up to questions. I'll take some. We'll share some with our other speakers. Would you like to start? Ma'am.
Hi, Kristen Graham from Philadelphia Inquirer. My colleague has done some reporting about vaccine rates and related from Philadelphia schools. We know in some communities the rates have dropped pretty precipitously. There's a deal that was 95% for the community. I wonder if you could talk about, are you concerned about this, and what efforts are you doing to address that?
Absolutely. I will bring in Dr. McDowell in a sec, because when we talk about schools, I want to make sure she's involved. But I'll start off and say that what you're seeing today and these 2 weeks at Ben Franklin High School is part of that response, is making sure the vaccines are ready and available for folks. A lot of times it just hasn't been available, especially since the pandemic. We've seen the number of vaccines drop, and we're trying to get folks back on the course. And as Dr. Stanford said, making it easy and accessible is the first step to doing that. Dr. McDowell?
Thanks for that question. In terms of what the School District of Philadelphia is doing, we have held multiple summer vaccination events throughout the city. And then, of course, the vaccination events that we're holding right now at Benjamin Franklin High School. But in addition to that, throughout the school year, we have partnered with the partners that you see today, Black Doctors Consortium, GPHA, and other partners, where we will be going into schools and using the data that you just pointed out. Once we get those final numbers, we're using the data to be able to go in schools and provide immunization clinics in the school. So that's the part that we're doing from the School District of Philadelphia side to improve those numbers of our kindergartners getting vaccinated. But we're also working with the health department as well. We meet with the health department's immunization team and their ambulatory care team as well on an ongoing basis to make sure that our families know what resources are available and we're getting them out to families. And then also to know where we are as a city in regards to our immunization rates. Because as mentioned, it takes the school district, it takes the city health department, it takes our community health partners and our doctors so that we can improve those vaccination rates for children that are kindergarten age.
And just a quick follow-up on that, obviously there are efforts being made at, you see at, whatever school at a dramatically lower rate, you all could go in there. What about staffing levels in terms of like school nurses are key to, checking vaccination rates and maybe doing some outreach to families saying, hey, your student doesn't have these vaccines. Where are we in terms of
Yes. Yeah, so thank you for that. As you know, school nursing has been on Superintendent Watlington's strategy 1.9, recruitment and retention. I'm happy to report that we have a nurse in every single district public school this year and last year.
How many Philadelphia schools have vaccination rates below herd immunity, and how have you seen that trend line changing in recent years?
So the data that is publicly available right now is through the state. So that is available on the dashboard. School just started, so we are still working to make sure that we're getting accurate numbers and we're verifying those numbers within our vaccination system as a district. So at this time, I can't tell you that, but most likely in the next 2 weeks to 3 weeks, our nurses are working very hard to connect families to vaccination clinics throughout the city, to provide families with information about vaccines, and then also inputting vaccination data into the district's immunization system so that we have accurate information to work off of. Yeah, I think, what we've seen is what we're seeing nationally as well and across our state. We're seeing those numbers decline, right? The good thing, though, in Philadelphia is that we do have resources, we have great healthcare partners, and our vaccination rates are not declining probably at the same rates as we're seeing in other counties, right, in Pennsylvania. And we are working very hard to maintain the vaccinations where we are. Most of our families are getting their children vaccinated, and we're very happy about that.
Given that, from a safety standpoint, how do you operate any differently, or do you operate any differently in an environment where you have these reduced vaccination rates from a safety standpoint in terms of how you keep people safe?
Yeah, I will. So that's a general question. I'll let the health department come in and answer that question in terms of how the city should be operating in decreased vaccination rates.
Does that make sense, Jim? I mean, you are in an environment where you have reduced vaccination rates from where you want to be. So what does that mean for how you operate from a safety standpoint?
Well, our response to living in a world with decreased vaccination rates is just what you see. It's bringing together all of our partners who have a hand in essentially getting us back to where we'd been for decades, where everyone was vaccinated and there was no question about this. It's bringing folks together. It's bringing together the brains, setting up opportunities to push vaccination and make sure that folks get vaccinated before we get into a situation where you do have an outbreak.
Does it change how you operate, though, just in terms of preventing spread or anything else?
Not at all. From the health department's perspective, one measles case in Philadelphia is an outbreak. and we bring to bear the entire resources of the health department to respond to that. That includes doing interviews with everyone who that person may have been exposed to, tracking where they've been throughout the region, and working with partners to be able to identify those people, make contact with them, and recommend quarantine if necessary.
Okay. I had a medical measles question. I saw Dr. Stanford come up there. She might be the one who knows the most about it. Because I spoke to the coroner in Lancaster County yesterday about that infant case, and he told me that the cause of death was laceration of the spleen and hemorrhage internally. He described it as traumatic rupture of spleen. He said that as he said, don't consider that to be a measles death. But I wondered, is there any connection between things that measles can cause and issues with the spleen? From a medical standpoint, is there any light you can shed on that?
So I'll come back to the spleen question, but I want to follow up on Dr. McDowell just to honestly commend the school district and say the fact that we're at Benjamin Franklin High School and 440 North Broad is the administration building. Students are arriving there to get enrolled in school. The school district is saying, you need your measles, you need your polio, and they are coming right next door and getting what they need. We were at Strawberry Mansion. We saw kids from over 30 schools. And Willie Mae, I have to give a shout out to her because she is my vaccine czar. But we had 14-year-olds getting 4 shots. And we said, why so many? And they told us, as you know, during COVID and after, a lot of people fell off. So many of those kids were 7. So now they're coming back to us at 14, and they missed those shots that they would typically have gotten 6 years old, 7 years old. So as you mentioned, parents are coming and they're getting the catch-up. And so I'm happy to report that. It's anecdotal, but every day you guys let folks know we're here, more people show up. So not knowing the circumstances and not knowing the age of the child, obviously.
They said he said it was shortly after birth.
I mean,
it was a newborn.
There's a myriad of reasons for a ruptured spleen. It could be part of delivery. It could be how a child was handled. There's a myriad of things, but I don't believe there's any cause and effect of having measles and having a ruptured spleen. Dr. Hayes, would you? Yeah.
Okay. Mm-hmm. Thank you.
Courtney with Philly Boys. So just to be clear, if the data shows that certain schools in the district are below vaccination levels, is the city and the partnership's going to go into that school and set up a clinic? Like, how's that going to work?
Yeah,
And like, when would that happen? Like, how soon would that happen?
we are planning to start that the end of September, beginning of October. We have to make sure, again, that our data is accurate. Everything that we do is informed by data. So we have an amazing team in the Office of Student Health Services with clinicians and others. We use data to see what schools we need to prioritize, and then we work with our partners that I have mentioned to go into those schools. Of course, everything is with parental consent. So parental consent is obtained. We've done this in the past as well. This is not new. We've been doing this for years, actually. But this is the first time we've really had a critical mass of partners, and also the time is now because of what we see with declining vaccination rates and measles throughout the Commonwealth. So that's how we will do it.
And then just to follow up, like, is it going to just be free, or how are you going to vet the...
So the district, we're focused on equity. We know that's why we do this work. As Dr. Stanford mentioned and I mentioned, we know that families actually trust the school as a place where they can get services like healthcare and immunizations. And we saw that throughout our summer events that we held throughout the city. And we partner with organizations, our federally qualified health centers, our community health centers as well, that are committed to serving the community, serving those that are uninsured and underinsured. No student that receives vaccinations in our school is ever turned away from receiving their vaccines.
Thank you very much. Courtney, your question was around schools being below the 95% herd immunity percentage. I just want to point out that things don't magically go away when we hit 95.001%. Our goal is to vaccinate as many people as possible. So, I applaud the work of the school district. I know we work closely with them and all of their partners to make sure that we're going to these places where there is an identified need. But the job doesn't stop there. This is a constant need to make sure that everyone is up to date on their vaccines. And every day there are new babies being born, and as soon as they're born, that's when that process starts all over again. So I do want to make clear, everybody is very focused on this 95% herd immunity rate. That number is not a magic number. Everyone getting vaccinated to protect themselves and their families and their communities is the goal.
Do,
My name is Remy Telemundo. Do you guys, language is sometimes a barrier for Hispanic communities and such. Is this information and resources also available for Hispanic communities? And what's the approach to those kind of things?
I can speak from the city perspective that all of our vaccine resources are available in multiple languages through the website and through printables, but I think it may make more sense to talk with Dr. Stanford in the community.
Thank you for that comment. So I usually start with, mi nombre es Doctora Stanford, yo hablo un poquito español. And then I find someone who speaks much more Spanish. But we have folks often come with their vaccination records that are in Spanish that we have translated. The viz and all the information we provide is in Spanish. And honestly, the communities communicate more with one another and say, this is a good place to come. And I can see it because at the top of the week, there'll be a handful of folks. As you get later in the week, there'll be more and more folks. And so, yes, is the short answer, but we can always have more translators.
Great. My second and last question, Doctor. Have you seen a response from the Hispanic communities, same as
I have. And I'm just going to stop with that just because of the climate that we're in, but
Yes,
we have.
Thank you.
Sorry, one more question for Dr. Stanford. Are there things that we learned during the pandemic that you're putting into practice now to try to increase vaccination rates?
That is an excellent question. So one of the things that the school district is doing are the trusted community partners. So many people that are are saying, you gave us our COVID vaccine and that's why we knew to come here. I asked Dr. McDowell earlier this week, this is brilliant. Did you always set it up this way, right adjacent to? And she said, no, this was the first year. And then previously, there were folks that gave vaccines, but they didn't do physical. So I think the more that you can encompass all the services, doing social determinant screenings, doing mental health screenings, doing vision screenings, and it can be a one-stop sort of shop for kids and also families, because GPHA, for example, people can go there and get care for the whole family. They can come to us and get care for the whole family, and it really becomes a resource location. So yes, the trusted messenger and then the people telling their people is really how the spread is happening.
You
the
mentioned
spread of information, that is.
You mentioned that some kids coming in and catching up from the pandemic and that hadn't had all of their vaccines. How much does that contribute to the reduced rates, do you think, or is it more a factor of people choosing not to get them?
So I don't have the data on how many people are exempt or have sort of requested that, but the folks who are coming in, we have a PhilVax, because most of these are Philadelphia kids, and it tells us when they got their last vaccine, what they're due for, and so if there's any hesitancy, I can say, well, I see they got it 2 years ago, so we're here to give it to you today. And so I would not concur that is what's happening.
No, I just was wondering how much do you
attribute it to?
Do you attribute the reduction to people choosing not to get it, or maybe just not being caught up yet?
Because I'm an optimist, I'm gonna go with access.
Okay.
And the fact that we've been having these all summer, and it's been standing room only, and we turn no one away, and we're pretty busy. I'm going to go with access. Yes.
Yeah. Classes have already started. So for those children that still need the vaccination, what they can do, how many days we're going to be here for them?
So, yeah, she informed me, but I'll the 5 day and the 30.
So, students that still need their vaccines, we've been doing this clinic for 2 weeks, and the clinic ends this Friday. However, you can actually go on our website, philasd.org/vax, and there is a list of places where students can get their vaccines. So the health centers are one of them. Some students, they can get vaccines at the health centers. We also partner with Delaware Valley Community Health, Maria de los Santos as well as a clinic where students can go and get their vaccines as well. In terms of students needing their immunization, so to enroll in school, students do need immunizations. They need to be up to date. And then once they're enrolled in school or attending school, students have 30 days to get caught up on their vaccines.
And for those parents that have hesitation and doesn't know if they can get vaccine or not, can you remind the importance to get vaccine for the kids?
Yes. So vaccines, we know they have been studied. They are safe. Vaccines are safe. We know that vaccines work as well. We know that vaccines work from the decades of data that we have showing that they're effective. And we also know that vaccines work in real time with our current measles outbreak that's happening across the Commonwealth. Every single individual that has been infected, hospitalized, and unfortunately passed away from measles was unvaccinated or undervaccinated. These vaccines work to protect our children against chickenpox, whooping cough, measles. They work to protect children from being hospitalized, from getting sick and missing school. Strongly encourage, if you have additional questions, reach out to your doctor, talk to them, talk to someone that's trusted, reach out to your school nurse, talk to them as well, and get information from credible resources.
Thank you so much.
I have one follow-up question. Students technically under state law can be excluded for not having gotten fully vaccinated, and in past limited circumstances, I know the district has done that. Is that something that you do? Is that something you plan to do? Is that a tool in your arsenal, or will those students not be excluded for not being vaccinated?
Yeah, so that is part of state law, as mentioned, and we do follow the state law, and it's our Board of Education policy that we follow exactly that. So there is risk of exclusion if students are not up to date, and that is why the access piece is so important, because we want to make sure that students are in school. We want to make sure that they're attending, and in that they can enroll in school without any barriers. And so that's why we have these vaccination events.
Have students been, for instance, last year where the students were excluded for not having either vaccines or, an exemption on that?
We do follow the state law in that regard.
Thank you all very much. I really do appreciate